I'm Dr. Piter Martinez Benitez, specialist in cardiology from Hùng Vương General Hospital. I have been working in Vietnam since 2018. Today, I would like to talk about non-communicable disease, focused on cardiovascular diseases after COVID-19 pandemic. At the 6th National Scientific Conference in Hanoi in November 2017, the Vietnam Medical Association and the Ministry of Health write the fact that non-communicable diseases are now the leading cause of death in Vietnam, accounting for 73% of the total death in Vietnam and 33% of total correspond with cardiovascular diseases. A cardiovascular disease is the group of diseases affecting your heart and blood vessels, including coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, congenital heart disease, deep vein thrombosis, and pulmonary embolism. Cardiovascular heart disease are influenced by the wide diversity of risk factors such as tobacco use, excessive alcohol consumption, unhealthy diet, physical inactivity, overweight and obesity, elevated blood glucose, and elevated blood lipid. The combination of the reduction of risk factors in the general population, primary prevention in high-risk group, and intensive treatment in secondary prevention was claimed to be the best strategy to reduce cardiovascular disease mortality. Consultation with specialists are essential for safe and high-quality care for all patients. Cardiology consultation, due to progressive increase in cardiology morbidity, are becoming more common in hospitals. Cardiology consultations play an important role in the diagnosis and treatment of heart diseases, but they are also crucial in educating of lifestyle changes. In my hospital, we have a specialist cardiovascular consultation. From the data of this consultation, a high prevalence of arterial hypertension was observed, and dyslipidemia. The prevalence of smoking was significantly higher in men. The prevalence of coronary artery disease and diabetes was also high. The main diagnoses at admission were high blood pressure, coronary heart disease, heart failure, valvular heart disease, and arrhythmia. But a high proportion of patients with hypertension didn't have adequate control. Only 11.5% of patients have optimal level of LDL cholesterol corresponding with the cardiovascular risk. The level in terms of prevalence, knowledge, and control of arterial hypertension are really worrying. The prevalence of smoking in men was also high, and it could lead a significant number of deaths. Most patients with a history of coronary artery disease have elevated LDL cholesterol level based on the risk, and heart failure with preserved ejection fraction prevail mainly in women. The evidence from this study provides valuable information on the behavior of cardiovascular disease on the risk factor and could be the guide to implementing effective intervention focuses on prevention and control of non-communicable diseases. COVID-19 pandemic restriction took severely limit access to healthcare. The follow-up patient was affected as well as the early diagnosis of cardiovascular disease. Other factors related to the pandemic were decreased physical activity, weight gain, and increased tobacco and alcohol consumption. Cardiovascular disease mortality was expected to increase during the COVID pandemic, but that increase was really shocking, and is particularly high among young adults. From 2010 and 2019, the death rate dropped to 5.5% for adult age 35 to 54, but in 2020, it jumped 12%, erasing previous progress. The same was reported for adult aged in 55 to 74 years. In this group, the death rate initially fell to 2.3% between 2010 and 2019, but after that increased 7.8% in 2020. The consequence caused by the pandemic will last for many years. It's essential to support and improve the strategy aimed to reduce non-communicable disease mortality, provide services that improve diagnosis and treatment and rehabilitation, including control of the risk factors such as hypertension, hyperlipemia, and diabetes, as well as education or health lifestyle is mandatory. Applying the lesson that the pandemic has taught us will allow us to move faster in the future. From the family to the medical service, from the medical service to the family. Together, we can do it. Thank you so much.